cardiac cycle and ECG. So when I say cardiac cycle, what do I mean? See, cardiac cycle in its most layman term, we can define it as a cyclic set of sequential events. Cyclic set of sequential events which involves pressure and volume changes as well as depolarization and repolarization changes within the four chambers of the heart, due to which the heart can pump. It goes under sequential contraction relaxation, and blood is either uh, expelled out of the heart or it gets into the heart. This is the most layman definition of the cardiac cycle. Now, in order to understand the cardiac cycle, you know there are four chambers of the heart: right atrium, left atrium, right ventricle, left ventricle. This is a basic thing. But apart from this, you need to know about a certain important musculature present in your heart. That is called the nodal musculature, and this is a special these are special tissues present in the heart. These are special cardiac tissues, and they have a property called autoexcitability. They're autoexcitability. They have autoexcitability. What is autoexcitability? Means they don't need external stimulus. The most laymanly, if I say, it means that you don't need to touch your heart, or you don't need to give any special signals from your brain or your psychic signals for your heart to continue pumping. You don't need to ask your heart to pump. It will pump on its own. Okay. Now, there are special tissues, as I said. These are nodal tissues, and these nodal tissues are present all over the heart. Okay. Cardiac musculature, mainly in the right atrium, as I say specifically. The right atrium, this cardiac musculature are uh, aggregated at certain places, and they form nodes. What the nodes they form? They form the sinoatrial node in the right upper corner of the right atrium, and in the lower corner of the right atrium near the tricuspid valve, we have the atrioventricular AV node. Okay, now fine. Now this is very important to understand. Most people miss it or may not miss if they're taught that acid node is called the pacemaker of the heart. Why it is called pacemaker? Is it the only node which is generating this autoexcitable impulses? No. The, all the nodal tissues are involved in this. All the nodal tissues have the ability, but acid node has can generate action potential at the rate of 70 to 75 per minute, as mentioned in your NCERT. The data is from your NCERT. So 70 to 75 per minute means actually a very huge number, and this corresponds to your heart rate. So it is 72 per times, we say it's 72 times per minute average of human heart pump. 72 times per minute, it corresponds to the auto-excitable nature of your SA node. However, in the same plate, we have the AV node. AV node can also generate action potential. It can also auto-excitable and don't need external stimulus like the SA node. Okay. Now, but its rate of action potential for me is lesser. It's more probably 50 to 60. I'm not sure with the data perhaps now, but it's lesser. That's why the SA node is called the pacemaker. It maintains. It has the most one, so it is actually the one who helping in the pumping. Okay. Another in this now in this cardiac cycle, you need to have a good vocabulary. Good vocabulary with the cardiac musculature. What are the vocabularies you have to be enshrined with? One is the systole, and one is the diastole. When I say systole, it means contraction, and when I say diastole, is relaxation. Relaxation. Okay. Similarly, there are, and if I tell it in ionic terms, because there are ionic changes occurring in this entire cardiac cycle, which is not mentioned in NCERT and actually not required in this stage. You will understand there, these things you will go and study in DBS. This is not required actually, but this they have just mentioned depolarization and the depolarization. Now, depolarization means systole here and repolarization means diastole here. You just remember these things. This is the most basic thing you need to remember now. And if you want to understand this depolarization and repolarization more nicely, you may comment upon and I will explain it on a different video. Okay, because repolarization is the most profoundly can be explained through nerve impulse, this action potential generation through the exoplasm, and also you need to know about the resting membrane potential of the nerve. Actually, there is no nerve in the heart. Okay, no nerve which is mediating because there are autoexcitable tissues. But similar things happen all over your body. Okay. Now, in an NCRT, they have mentioned it, the mixture of actually cardiac cycle can be explained in terms of volume, in terms of pressure, and in terms of electrical activity. That is profoundly more actually explained through the ECG. However, the cardiac cycle mentioned in your NCRT is a mixotrophic type of explanation which contains pressure also, volume also, and mostly they have covered this pressure. They have means under the umbrella of ionic changes because at last ECG is also explained here. You can read it, but it's very little written upon there. I'll explain it. Don't worry, a very easy way. I will try my best. So now let us. But I will explain here the cardiac cycle in terms of pressure also, volume also, and electrical activity as explained in your uh, book. But keeping in view what are the things you are missing out. You see, through the vena cava, superior vena cava, we have this deoxygenated blood entering your right atrium. Okay, now let us consider this is a pressure P. There is a pressure P in your right atrium, and in your right ventricle there is a small pressure. There is a certain pressure P, rho. Okay, now you see if you have a door here, and if this side pressure is lesser than this side's pressure, the door is not gonna open like this. Okay, the door is gonna be closed. And if this pressure, you keep increasing the pressure such that it is either greater than or equal to this pressure, then this door will open. Okay, then this door will open. So this is the concept of valve. So we have two valves here. What are the valves we have? Let me write P and rho here. This valve system, this is tricuspid valve between the right atrium and right ventricle, and between the left atrium and left ventricle, we have the bicuspid valve or the mitral valve. Okay. Now see this valve, there are three cusps, that's why they're called tricuspid valve, and there are two cusps, that's why they're called bicuspid valve. You can leave it for now, it's not very important thing. Okay, now you see the blood has entered and it is entering. Initially, all the chambers were in complete or joint diastole means they were not under any certain ionic changes or they were under a relaxation phase, joint relaxation phase. Now, as the blood has entered, the deoxygenated blood has entered, the pressure starts to increase in the right atrium. As the pressure started to increase in the right atrium, at a point where this pressure is greater than this pressure, this valve between this right atrium and right ventricle called the tricuspid valve will open up. Okay, this open up. This has opened up, and this blood will come in this right ventricle. Okay. Now, what is right ventricle? Okay. So this is falling in your right ventricle. Now, by this is a passive mechanism. There is no means this has occurred due to pressure only. You have not there is no any action potential which is involved, or there is an active force which is involved in causing this blood flow from atria to ventricle. So this is passive flow of blood, and through it we have 70% blood, 70% of the volume of blood being flowed into this right ventricle from the right atrium, right? This has occurred. Now, what we have this acid node. Acid node, it generates action potential. Okay, as the acid node generates action potential, this is spread throughout the cardiac musculature of the right atrium, and the atria contracts. Now the atria start contracting. Means by the time atria start contracting, blood is already flowing in the right ventricle. So this contraction do what? This contraction causes extra expulsion of 30% extra blood into this right ventricle. And this is what is written in your NCERT. See, the SAN generates action potential which stimulates both atria to undergo simultaneous contraction. The atrial systole, this increases the flow of blood into the ventricles by about 30%. Okay, so this is happening actually in the both of the atrias, but here I am explaining taking the right ventricle so that it is right atria, right ventricle, so that you can understand the sequential events. So there is depolarization. Here we have first one depolarized state. This is the first depolarized state because of which 30% blood has entered into the right ventricle. The blood has already come to the place where we want it. Okay, now this blood has come here. Now sequentially, this impulse from this sinoatrial node will reach the AV node. And in this AV node, what will happen? Through this AV node, through bundle of his spread all over the ventricles. Now the ventricle will contract, but before that, what is happening? The blood is flowing and it keeps flowing and keeps flowing and it keeps flowing. As a result of which, the pressure rho has increased, then this pressure, this pressure has increased over this pressure. And as this pressure is increased, the blood will try to go back, and in this time the valve has closed. This tricuspid valve closes. And similarly, the bicuspid valve closes this side too. Okay, bicuspid valve closes in this side too. And now, as the impulse have reached the AV bundle and through the bundle of His, the contractional stimulus has reached these places. This ventricle will undergo contraction, simultaneous contraction, and this blood will be ejected through the pulmonary artery to the lungs. And throughout the lungs, okay, artery, and from the lungs, if see here in this, here also, this pulmonary artery has this valve called a semilunar valve. Okay, and it also goes and it opens it. Okay, this blood flow opens it and it goes to lungs, and oxygenation occurs by diffusion. Means the carbon dioxide is going out and oxygen from the lungs is coming in the blood, and this oxygenated blood is coming to the left atrium. Okay, through the pulmonary vein. And now the thing is, this is coming and filling here, and similar event which has occurred in this place, this side will occur also this side. Is the contraction is going this side, so the similar contraction of events will go on the left side too. So what will happen when this blood is flowing down? This blood will also flow there. As this right ventricle is contracted, left ventricle will also contract, and it will be closer of this valve too. Simultaneous events are occurring here, and as there will be a contraction in both sides, this oxygenated blood will go out through the aorta to other organs. So this is here we can see there are two circulation occurring. There is a pulmonary circulation involving pulmonary artery and pulmonary veins, and there is a systemic circulation through the aorta and systemic arteries and systemic vein, again returning to the superior vena cava and inferior vena cavas. The thing continues and continues and continues. This is the cardiac cycle actually. Here we will try to see what is written here in your NCERT. Now we will see so that it will be easier for you. See, to begin with, all the four chambers of heart are in relaxed state, as I mentioned earlier. As bicuspid, tricuspid valves are open and the blood flows from pulmonary vein and vena cava into the left and right ventricle. As I said, the bilateral events are occurring simultaneously. I have started everything from the right atrium and go to right ventricle. But what is happening in the right atrium? A similar event is going on the left atrium too. You try to correlate with this. have done it sequentially, but it's so fast, right? But whenever this event is started, the earlier event of left atrium is already concluded. So means there is something going on both simultaneously, right? You see now what is it? The semilunar valves are closed at this stage purely because the blood has not been ejected out from the ventricles. And this is SNO thing, 30% extra blood. Action potential conducted by ventricular side by AV node and AV bundle, where bundle of which transmits to the entire ventricular musculature, causes ventricular muscles to contract. The atria undergoes relaxation and has to coinciding with the atrial systole. Right. Atrial with relaxation, atria undergoes relaxation. So means by the time this left ventricle is undergoing this diastole, the systole, the atria is under what? Diastole. Okay, the atria is relaxing because blood is flowing inside and is being ejected out, and then back then ventricle is contracting. Ventricles are contracting. Ventricular pressure systole increases the ventricular pressure, causing the closure of tricuspid and bicuspid valves, and this produces the first heart sound, HS1, if we say lump sound, due to attempted backflow of blood. As the ventricular pressure increases further, semilunar valves guarding the pulmonary artery side and the aorta are forced open. As I said, the semilunar valves are forced open. Semilunar valves are present in both a pulmonary artery and the aorta. Okay, and you see what is happening. The similar thing. The ventricles now are cause relaxation. Ventricles will now relax because the contraction is done. This impulse is gone. It will relax, right? And the ventricular pressure decreases. So similar thing here. The pressure is considered the pressure in ventricular pressure, which is forcing it open. See, now the ventricular pressure is decreased. So means the pressure which was forcing the valves open will now be lesser than that in aorta and pulmonary vessels, right? And due to which what? There will be an attempted black flow of blood in the similar case, or due to pressure difference, whatever you said, the semilunar valve will be closed, producing the second heart sound, HS2, right? This is dub sound. And now see the atria has relaxed, the ventricles have relaxed, and again the same thing will occur cyclically to cause this cardiac cycle. So this is the cardiac cycle in terms of pressure, in terms of volume, and in terms of depolarization, repolarization as mentioned in your NCERT. Now we will go to the ECG, electrocardiogram. So let us, before the ECG, okay, there are some terms like stroke volume. Stroke volume is volume of blood pumped by each ventricle. So whatever the volume of blood is pumped by each ventricle which is moving into the aorta and the pulmonary artery. This is the stroke volume. Okay. Now you see we will start about ECG. 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 So this is the ECG mentioned in your NCERT. This is the ECG mentioned in your NCERT. You see, ECG, the full form, ECG's full form is important. Electrocardiogram. The paper on which the ECG, or the graphical representation of the cardiac cycle, is noted is called electrocardiogram. And the machine is called graph. Remember the machine through which the ECG is obtained is called electrocardiograph. Okay, now how is ECG obtained? You see, this is a person. Pardon my handwriting, it's a drawing, whatever it is. So on your right, let us say right, this is right wrist, left wrist, and left ankle. Okay, ankle means ankle joint. Near the ankle joint, near your wrist, these three leads, ECG leads are kept. Okay, basically ECG has 12 leads. You don't need to know what are the 12 leads now. You just, I'm telling what is written in NCERT because ECG is actually a game of vectors. game of vectors, and there are certain vector addition, vector resultant taken out by the machine. You will know about which is required. So there are three leads. Okay, limb leads. There are six limb leads. You must remember there are six limb leads. Six limb leads means the limb leads means what? They are attached to your limbs for hand and legs, and six chest leads. There are six chest leads which are attached to your chest. So what this is what I mentioned in NCRT. Okay, and here we have this leads. Okay, there are three limb leads, six limb leads and six chest leads. That is done. Next, so first of all, there are segments, complexes in an ECG. Okay, these are the parts of ECG. So what are the things here? We have seen this as a P wave, a QRS wave, and a T wave. Mainly the positive and negative waves. Okay, you see P is a positive wave, Q is pointing downwards a negative wave, R is a positive wave, S is a negative wave, and T is a positive wave. Okay, so these are positive and negative waves. These are based on the electrical activity, how the depolarization is occurring. Okay, and based on how they are received through your different leads. Nice. Okay, the P wave. What does P wave means? P wave means atrial depolarization. When I say atrial depolarization, they means atrial contraction when the atria has contracted. And when I say atrial contraction, you remember the SA node has generated the action potential. So that is sensed, or that is represented as the P wave. Okay, now in an ECG, if there is no P wave and there is just QRS complex, remember you think it's like this. So there means there is a problem with the SA node. Okay, then this QRS complex, it is ventricular depolarization. This is P wave. Now we have the QRS complex. This total complex, Q then R and S is a complex. Okay, com combination of three waves. Combination of waves is called complex. And now these three waves together is represents the ventricular depolarization. Means the ventricle has gone under total contraction. It means the a signal means AV node has generated action potential which is transmitted through the bundle of his. Okay, bundle of his. And now see, when is PR segment, what's segment between this P wave and the R wave? This represents the signal is being transmitted from SA node to AV node. This is mentioned. And if there is a prolonged PQ, means P, this is increased, P and Q is increased, you may say that this certain deformity or a certain problem in regards with transmission of the signals from AV node is SA node to AV. Now the ventricle have contracted, and we have seen already the ventricular depolarization or ventricular contraction and atrial repolarization or atrial relaxation occurs together. And since the ventricular depolarization has much more strength, okay, it shows more strength than this QRS, than this the repolarization. That's why the atrial repolarization is not shown on the ECG. It is covered under the umbrella of ventricular depolarization or ventricular contraction. And after this, we have the T wave. Okay, we have this T wave, ventricular repolarization. And when I say T wave, it means ventricular relaxation. T wave. Okay, ventricle has started to relax. And when it is completely relaxed, the T wave ends. Okay, the T wave ends. And what does it mean? The end of systole means the ventricle has come under complete diastole, and under the joint diastole, It has come under the joint diastole. So it is a state in which we have found the cardiac cycle, another cycle will start. Okay, so another cycle will start. So this is the ECG, electrocardiogram, and I will attach a question, a Google form, asking having some questions regarding this chapter. If you feel free and if you have time, you try to attempt it and check your aptitude in this chapter. Okay, thanks.